Look down at your hands right now. Really look at them. Because what's sitting at the tips of your fingers might be quietly telling you something about one of the hardest working organs in your body. And most people never think to check. There are changes that can show up in the nail bed. Little shifts in color, texture, and pattern that in some cases have been associated with kidney function. Not everyone who notices these changes has a problem, but knowing what to look for can be the difference between catching something early and missing it for years. Today we're going to walk through 6 things you can look for in your own fingernails, one at a time, slowly enough that you can actually check your own hands as we go. Some of these are well known. A couple of them are so easy to miss that even people who've been managing their health carefully for years have never heard of them. And I want to be upfront with you about something before we start. Nails can change for dozens of reasons: nutrition, aging, thyroid issues, medications, even how much you've been washing dishes lately. Nothing here is a diagnosis. Think of this more like a set of clues, the kind of clues that, when you notice them, are worth mentioning to your doctor, not something to self-diagnose from a video. Kidney health tends to get overlooked because the kidneys don't usually cause pain when something's going wrong. They just quietly do less and less of their job, and by the time people notice fatigue or swelling, a lot of time may have already passed. That's part of why looking at something as visible and simple as your fingernails can matter. It's a window you can check for free anytime without an appointment. Let's get into it. Sign 1. Pale or washed out. Nail beds. Healthy nail beds usually have a pinkish tone. That color comes largely from blood flow close to the surface, and it can reflect things like your red blood cell count and how well oxygen is being carried through your body. Your kidneys play a role in this process. They help produce a hormone that signals your bone marrow to make red blood cells. When kidney function is reduced, that signal can weaken, and some people develop a lower red blood cell count as a result. Something often referred to as anemia related to chronic kidney disease. Here's a simple thing you can try right now, sitting exactly where you are. Press down gently on your thumbnail for about 3 seconds, then release. In many people, the color rushes back to a healthy pink within a second or two. If it takes noticeably longer to return, or if your nail bed already looks pale or almost white before you even press it, that's worth paying attention to. I think about a patient I'll call Margaret, a woman in her late 60s who came in for a routine visit and mentioned, almost as an afterthought, that her nails had just looked kind of pale for a while. She hadn't connected it to anything. It wasn't the reason she came in, but it was one of several small pieces that, put together with some lab work, painted a clearer picture of what was going on with her kidney function. She told me later that if she'd known to mention it sooner, she might have brought it up years earlier. To be clear, pale nail beds can come from plenty of things that have nothing to do with kidney health, iron deficiency being one of the more common ones. So this sign alone doesn't tell you much, but paired with other symptoms, or just as a reason to ask your doctor for a basic panel next time you're in, it's a useful thing to notice. Sign 2. Nails that are dry, brittle, or splitting. Have you noticed your nails becoming more fragile lately? Splitting at the tips, peeling in thin layers, breaking before they even get a chance to grow out? This one surprises people because it feels so easy to explain away. Dry weather, too much hand sanitizer, aging, and often that's exactly what it is. But there's another possible piece to this puzzle worth knowing about. Your kidneys help regulate the balance of certain minerals in your blood, things like calcium, phosphorus, and zinc. When kidney function declines, that balance can shift, and some research suggests this may play a role in nail health, among other things. Firm, healthy nail growth depends in part on that mineral balance staying steady. I remember a man I'll call Harold in his early 70s who'd mentioned his nails just seemed to fall apart over the past year. He'd assumed it was simply part of getting older. It's a completely reasonable assumption. And often, it is just that. But it was one of the details we kept in mind while reviewing his overall kidney function during a routine checkup. It's also worth mentioning, and this is something more people should know about, that rapid, unsupervised weight loss, including from certain weight loss medications people are now using more commonly, can sometimes come with nutritional gaps that affect nail health too. So if your nails have changed and you've also had major shifts in your diet or weight recently, that's a conversation worth having with whoever is managing that treatment. The takeaway here isn't brittle nails equal kidney disease. It's simply this. If your nails have changed and you don't have an obvious explanation, and especially if it's been going on for a while, it doesn't hurt to ask your doctor for a basic metabolic panel next time you're in for a visit. If this is helping you connect a few dots about your own health, a quick like helps this reach more people who might need to hear it too. Now let's keep going, because the next two signs are the ones most people, including a lot of doctors outside of kidney specialists, have simply never heard of. Sign 3. The half and half nail pattern. This next one is subtle enough that I want you to really picture it clearly. Imagine looking at a fingernail where the bottom portion, closest to where the nail meets the skin, looks pale or whitish. And then, somewhere around the middle of the nail, there's a fairly clear line, and above that line, the nail takes on a darker tone, sometimes described as tan, brownish, or reddish-brown. It's essentially two zones on one nail, split roughly in half, with a noticeable line between them. This pattern has been associated in some clinical observations with reduced kidney function, and some research suggests it may show up in a meaningful portion of people with more advanced chronic kidney disease, though estimates vary, and it's not something every patient develops. Here's why this one tends to fly under the radar. It looks subtle enough that people assume it's just how their nails have always looked, or a normal part of aging. It's not dramatic. It doesn't hurt. There's no reason it would jump out at you unless you already knew to look for it. I think of a woman I'll call Renata, who came in for a follow-up on her blood pressure. During the exam, I noticed this pattern on several of her fingernails. When I asked her about it, she said she'd noticed it herself over a year earlier, but figured it was just one of those things that happens as you get older. It became one more piece of information that, along with her lab work, helped guide the conversation about her kidney health moving forward. If you look at your own nails and notice something like this, a fairly distinct two-tone pattern, pale on the bottom, darker on top, with a clean line between us, it's worth taking a photo and mentioning it at your next appointment. Not because it guarantees anything, but because it's exactly the kind of detail that's easy to overlook and easy to bring up. Sign 4. Terry pattern nails. This next one is named after the physician who first described it decades ago, and it has a fairly distinctive look. Picture a nail where almost the entire nail bed, the large majority of it, appears pale, almost white, and then right at the very tip, there's a narrow band of pink, reddish, or brownish color. So it's almost the reverse layout of what we just talked about. Instead of two roughly equal halves, you have a nail that's mostly pale with just a thin strip of color at the tip. This pattern has been associated with reduced protein levels in the blood, particularly a protein called albumin, along with changes in blood flow, both of which can be connected to kidney function, though this pattern also shows up in some other health conditions, including certain liver and heart conditions, so it's not exclusive to kidney health. When I see this pattern, along with anything unusual with a patient's urine, some people notice foamy urine or swelling in their feet or ankles. That's typically when I'll want to check both kidney function and protein levels more closely. I think of a patient I'll call Desmond, a man in his early 60s who mentioned he'd noticed some puffiness around his ankles by the end of each day, and separately, that his nails had started looking weird. His words. When we looked at his nails together, they had this pattern. That combination, the nails, the swelling, and a follow-up urine test, gave us a much clearer picture than any single piece of information on its own. Sign 5. Horizontal ridges or grooves. Now, this next one is different from the others because it's not really about color, it's about texture, and specifically about timing. If you look closely at your nails and notice a distinct horizontal groove or ridge running across the nail, not the fine vertical lines many people naturally develop as they age, but a clear horizontal line that can sometimes act almost like a timestamp. Here's the mechanism, as best we understand it. Your nails grow from a small area at the base called the nail matrix. If your body goes through a period of significant physical stress, including episodes where kidney function drops suddenly, sometimes called acute kidney injury, nail growth can briefly slow or pause. Once your body stabilizes, growth picks back up, and that pause can leave behind a visible horizontal line as the nail continues to grow outward over the following weeks and months. If you notice more than one of these lines spaced out along the nail, that can sometimes reflect more than one period of significant physical stress over time, not necessarily kidney-related every time, since illness, high fevers, and other major health events can cause the same kind of pause. I remember a patient I'll call Louisa, who had a hospital stay a few months earlier for a kidney-related complication. Several weeks after she was discharged, she noticed a single horizontal groove had appeared partway up each of her nails. It lined up almost exactly with the timing of her hospitalization, a small, visible marker of something her body had been through. This sign, more than the others, is really about paying attention to timing. If you notice a horizontal line and you also remember a recent illness, hospitalization, or period of significant stress on your body, that context matters more than the line itself. I want to pause here and say something important. None of these 5 signs, on their own, tell you that you have kidney disease. They're not diagnostic tools. What they are is a reason to pay a little more attention. A reason to mention something to your doctor that you might otherwise have brushed off as just my nails being weird. Chronic kidney disease affects a significant number of adults, and one of the challenging things about it is that it often doesn't come with obvious symptoms early on. People can lose a meaningful portion of their kidney function before they notice fatigue, swelling, or changes in how often they need to urinate. That's part of why paying attention to smaller, more visible clues, like changes in your nails, can matter. It's not about catching a single dramatic symptom. It's about noticing a pattern of small things and bringing them to your doctor before they become bigger things. If you have risk factors like high blood pressure, diabetes, a family history of kidney disease, or you're over the age of 60, that's all the more reason to be a little more attentive to these kinds of details, and to make sure you're getting basic kidney function testing done periodically as part of your regular care. Bonus sign, a rare but notable pattern. Now, as promised, here's a bonus sign, and I want to be upfront that this one is uncommon. But when it does show up, it tends to be fairly specific. Picture a nail with 2 distinct pale horizontal bands running across it, with a strip of normal, healthy colored nail sitting between those 2 bands. Unlike the horizontal grooves we talked about earlier, this pattern isn't really in the texture of the nail itself. It's more about color changes in the tissue just beneath the nail, which means it doesn't shift position as the nail grows out the way a groove would. This particular pattern has been associated in some clinical literature with a condition called nephrotic syndrome, where the kidneys allow too much protein to leak into the urine, leading to notably low protein levels in the blood. That drop in protein can affect blood flow and coloring in the tissue beneath the nail in this fairly distinctive way. Again, this is rare. Most people watching this will never see this particular pattern on their own nails. But if you ever do notice 2 pale bands with a strip of normal color between them, it's absolutely worth a conversation with your doctor, including asking about a protein level check and a urine test. So here's what I'd encourage you to do. Take a few minutes this week, not right this second under pressure, just sometime soon, and actually look at your fingernails in good lighting, without polish. See if anything we talked about today applies to you. If it does, don't panic and don't try to diagnose yourself. Just make a note of it. Maybe take a photo and bring it up at your next doctor's visit, or make an appointment if it's been a while since your last checkup. And remember, these nail changes mean much more in context. Are you also feeling more tired than usual? Have you noticed any swelling in your legs, ankles, or around your eyes? Has your urine changed, foamier than usual, or a different color? Have you noticed you're urinating more or less often than you used to? None of these things individually is a red flag, but together, they can help paint a fuller picture for your doctor. Have you ever noticed something changing on your body, nails, skin, anything at all, and just assumed it was nothing, only to find out later it actually meant something? I'd genuinely like to know. Drop it in the comments. Where are you watching from? Drop it in the comments below. Kidney health doesn't have to feel like a mystery. The more you know about what your body might be trying to tell you, the more empowered you are to speak up for yourself at the doctor's office, ask the right questions, and catch things early, while there's still the most room to make a difference. I'm Dr. David Aid, and if this video gave you something useful today, something you can actually use, whether it's checking your own nails or just being a little more aware of what your kidneys might be dealing with, do me a favor and hit subscribe so you don't miss the next one. I'll see you in the next video, and until then, take care of yourself.